Cardiovascular disease, we've made tons of progress in cutting risk in almost half over a 50-year period. Having said that, though, those numbers are starting to plateau. And so we really need to double down. Now, we always say about 80% of cardiovascular disease is preventable. And that's true. And it starts with the basics that really have not changed. Hypertension, smoking, diabetes, nutrition, weight management, these things are foundational. So while things have changed a little bit in the sense that what are some of the trends, what tools do we have available, how are people being treated currently, they still remain the foundation of prevention. And if we can make some good progress there, we can continue to markedly lower cardiovascular disease rates for the next 50 years. The thing about hypertension, it's so important because we know that almost 1 in 2 adults in the US have hypertension. It's that frequent. The other thing, there's a reason why it's been called the silent killer, for decades now. You don't feel anything for the most part until it's severe and extreme. But most people have absolutely no symptoms. And meanwhile, it's really, eroding from the inside, your heart, your brain, your kidneys. It has so many adverse effects. If you look in the world, it is the leading preventable cause of cardiovascular disease in the world. Before it was sort of, we waited till you have disease and then we started to think about it. We certainly are not doing that anymore. We really are looking for the, earliest signs of any risk where we have new tools, we have new ways. We really need to start prevention early in life. Heart disease begins in childhood. It doesn't start out of the blue when you're an adult or an older adult. So that's a fallacy that I think people are starting to get that message, but we need to amplify that more.